So good afternoon, everyone. Welcome to this year's 2021 Matrix and GP Track Summit featuring disruptive technologies and innovations. During this poster session, we have two posters being presented. The third one uh, did, did not did not finish going through legal approval, so they weren't able to present today. So we have the two posters that are presenting. And we hope that they will give us some insight into innovations and present new ideas to consider. The detailed data gathering and research into each of these areas is what makes undertaking telehealth research beneficial to all of us. We're grateful for that our presenters are willing to share their findings and know that you will come away with a better understanding of telehealth. Each presenter will be given up to 10 minutes or maybe a little longer today because we only have two posters to introduce themselves and explain their posters with questions after they present their posters. If you prefer, you may also use the chat feature on your screen to ask questions. In order to make sure all our presenters are allowed time to present, we'll stay firmly within the time limit and get everyone out of here at I think that's 2:45 is when this is supposed to end. So we do encourage everyone to vote for the People's Choice poster presentation in the Summit app. It's on the left-hand side of your main homepage at the on the Matrix website. So if you have any other further questions or would like to continue any discussion with any of our presenters, feel free to connect with them at the summit. To do this, review the attendees and then message them to connect at networking tables in the exhibitor space or email them. So with that, we will go to our first poster, which is being presented by Leica Devara and Brianna Coleman. Smart Glasses, a solution for the limitations to medical education brought upon by the COVID-19. So, thank you.
Okay.
Yeah. Hi, I'm Brianna Coleman.
And I'm Leica Devara, and we are second-year medical students at the University of Louisville School of Medicine. And as Mr. Bickle mentioned, our project is called Smart Glasses, a solution to the limitations to medical education brought upon by COVID-19.
We thought this project was necessary about a year ago when the pandemic started. We were really pulled out of the hospital as students, and we weren't really allowed to shadow or do any research that we had planned to do during that time, especially over the summer.
So during this time, an ER physician at U of L kind of developed a virtual shadowing platform using the M400 Vuzix smart glasses. And so the way the platform worked was that an ED resident would wear the glasses and were connected to students using Zoom. So both of us attended these sessions, and our immediate reaction was that, wow, that was amazing, and why do we not do more of it? So this prompted us to kind of ask the question if we could apply this platform in a more global manner and use it in any department so students could kind of shadow whatever specialty that they wanted to see.
So in order to answer this question, we really divided our project up into three different facets: communication, infrastructure, and technology. As for the technology aspect, we needed to get funding for the glasses. So our school, the University of Louisville, has a dedicated department for student groups to get funding. So we asked different student groups if they would help us and apply for funding. Of course, they could use the glasses if they would apply for funding. And we had quite a few groups apply for funding. So our university purchased 3 pairs of Vuzix glasses for us.
The next part of the process was communication. So we decided to serve kind of as liaisons between all the critical players that were necessary to really make this success. So that included the physicians, our school's academic technology office, and also the legal department at the university. So we worked with different physicians and our tech office to kind of develop a software that would make it really user-friendly for these physicians to use, and also talk to the legal department at the hospital so that any department could use the glasses without having to kind of individually go through the legal process. So we made sure to cover everything, including HIPAA compliance, protecting patient confidentiality. So it really was kind of just to get the glasses, wear them, and you could use them.
As for the infrastructure portion of the project, that included the manual that we made for the glasses, and then also a form for renting out the glasses, and also a form for detailing all the legality that we spoke with the legal department. And the manual really, is meant for somebody to have the glasses in front of them, go through the manual, and it really teaches them the hardware and also using the glasses with Zoom, really without me or Leica there.
So to kind of give a quick rundown of how a normal session would work, say I was the president of an interest group for general surgery, then I would fill out the forms that Brianna mentioned to kind of rent the glasses from our university's student affairs office. I would allow to have the glasses for about a week at a time, and I would need to have a set date of what the glasses would be used for. In the past, we've used the glasses for everything from viewing a specific surgery to going on internal medicine wards and kind of following the physicians that way. Generally, a resident will wear the glasses and connect to the Zoom platform. And the Zoom platform will also be an attending who kind of explains the cases and the science behind the different conditions. And then either the student leader or Brianna and I will be on the call as well to monitor the chat and also make sure students are following rules of HIPAA compliance and professionality. So we've also developed different email templates that student groups can use that kind of outline everything students need to do. A couple things include being the only person in the room, dressing professionally, and having their Zoom camera on, things like that to kind of alleviate any stressors of patient confidentiality. So each session lasts about an hour and a half to 3 hours and can cover a wide range of different procedures.
So what have we learned so far with this project? We've really gathered feedback from students in order to guide where the future of our project will go. As Leica mentioned, we've had multiple sessions so far. This includes general surgery, neurosurgery, and internal medicine sessions. And after each different session, we'll ask all the participants to fill out a survey in order to gauge their feelings about the sessions.
So far, our feedback has been overwhelmingly positive. 100% of the students have agreed that the use of smart glasses helps alleviate the limitation of preclinical students' access to shadowing, and over 90% of them would recommend this experience to other students.
We really found throughout this process that virtual shadowing can serve as a legitimate replacement for in-person shadowing. About 70% of respondents to the survey agreed that their virtual shadowing experiences were indeed comparable to their experiences that they've had in person before.
And kind of an outcome that we weren't expecting at the beginning of our project, but has been opening up a ton of doors for us, is the idea that virtual shadowing could be beneficial as a permanent tool and not just a replacement or supplement during the pandemic. 50% of respondents agreed that the shadowing session supported their learning style. So this kind of opens up the doors if you can use the glasses to maybe in an anatomy lab to kind of see cadaveric dissections, or even in the clinical setting to build grand round cases, things like that. 75% of students responded to the survey saying that smart glasses should be a mainstay in med ed. And really, we are really excited to kind of see where we can take that in the future.
The future of this project, as for the future of this project, we believe that technology does have a larger role in medical education. And with our survey, we hope to continue gathering data to support the idea that smart glasses can indeed be a permanent medical tool for students to use. Just like they use Boards and Beyond to supplement their different lectures, we want smart glasses technology and these types of shadowing sessions to be available to also supplement students' learning.
And finally, we would just like to thank everyone that's helped us throughout the process. There's a couple of people on this call too, Dr. Baker, Dr. Wright, and Mr. Gardner from our technology office. We appreciate their help and definitely couldn't have done any of this without them. And thank you all for taking the time to listen to us present, and we would be happy to take any and all questions.
I believe there was one question in the chat.
What brand of smart glasses do you use? We use the Vuzix M400 smart glasses. We actually have a pair here. So yeah, so they're kind of just set up like an actual pair of glasses. And there is a kind of a hardware piece that serves as the camera at the front right there that goes on one side, and the battery pack goes on the other side. There's a better picture of it on the poster, I believe. Any other questions?
Okay, no other questions at this time. If you all will stick around, and we'll go on to the next poster. Um, and then after Colton gets all his questions, just in case someone should happen to think of something. Another chat question did come up. So multiple students could see you at once?
Yes, so students kind of join the Zoom platform from their personal computers. So I guess the best part of this is that it's accessible to anyone no matter where they are. So far we've been having sessions with about 20 students on the call at a time, but we're also kind of exploring the idea of using lecture halls once it's safe for everyone to be in person also, so that any number of students could be in one room as long as there's a computer.
Very good. All righty. Well, if y'all would take your poster down right now, we'll get Colton up there. Our next poster is presented by Colton Hood. It's an evaluation of reimbursement for remote patient monitoring for patients discharged with COVID-19, initiated by the ED. So Colton, if you'll go ahead.
Hi, everyone. My name is Colton Hood. I'm Assistant Professor of Emergency Medicine at George Washington University. And my team and I developed a COVID-19 discharge program last year near the start of the pandemic. And this is a look at kind of how the billing worked out, an analysis of that. Remote patient monitoring has been in existence for a while, but the codes have evolved over the last couple of years to make it a little more feasible and generalizable. And when COVID is still happening, but when COVID evolved, we were looking for ways to keep our patients safe. And some were even thinking about ways that we could potentially reduce the burden on our hospitals. And so this is a little bit about our program and kind of what happened after it. Historically, it's been used for chronic diseases. I think the original codes typically needed you to be in a hospital, so probably at hospital discharge. But COVID gave us a new reason to look into this. GW is in Washington, D.C. It's an urban center. More or less, if the attending physician wanted to order remote monitoring, we gave a packet to our patients. It had a pulse ox, a consent about the program, information about the program, and they could really just leave with that. They could sign the consent, but we onboarded them at a later time just to make sure that they wanted to still do the program. And as a result of that, we actually ended up only monitoring 83 of 140 people we gave equipment to. The basics of our program were a daily email survey that included, physiologic and symptom monitoring, and the outline of our program is here in our programmatic overview. We also had the luxury of having a 24-hour call center staffed by EMTs and paramedics, and so that allowed this program to function in an acute setting. And sorry for not being left to right here, but just to speak a little bit about the RPM reimbursement and CPT codes. There are basically 4 codes now for RPM. at least in this evolution of it. The first code, which is 99453, is sort of your enrollment and registration code. When the services are ordered, patients receive their devices in training. There is a small reimbursement for that process. There's a second code, 99454, that reimburses you for the cost of your devices and data transmission and software services. It's kind of what its intent is to do. That can be billed once every 30-day period, with the stipulation that you need 16 days of data transmission, but that gets complicated because of the public health emergency, as we'll talk about at the end. 99457 is kind of your management services or your services for RPM. And that's typically 20 minutes of time spent either face-to-face with your patient or with services related to remote patient monitoring that don't cross into another E&M code, because it is an E&M code. And you may bill for additional 20 minutes if you so went into additional monitoring, which happened in COVID. And there's a caveat with that requires at least one real-time interaction. And as for our results, not every insurer reimbursed for monitoring. Medicare reimbursed for monitoring almost universally, and only some of our Medicaid providers did. 75% of our billed payers reimbursed something. And as far as reimbursement was concerned, using Medicare rates is about 100%. Our commercial insurers reimbursed 160% of that, and our Medicaid providers reimbursed about 115% of that for 99453, 54, and 57. Interestingly, the extra 20 minutes was closer between the pairs. Overall, RPM was made more feasible and easier by the CMS pandemic waivers. The little star back here is when you're monitoring for COVID, you actually only need 2 days of transmission for the 99454 CPT code. However, in 2021, that's slightly more complicated. The wording is a little more vague. If you're going to do a remote patient monitoring program in this way for more likely chronic conditions, I would probably try to understand your payer mix and how they reimburse. We were kind of surprised not all payers reimbursed, and it just would be important to understand how this will pan out, especially because devices are expensive and the platforms can be expensive, so you can understand the return. And for us, we weren't allowed to the devices we were told to get them without strings, and they were fortunately affordable pulse oxes. And about 40% of our equipment was lost because people didn't want to follow up or didn't want to enroll in the program. And so just kind of understanding how patients use their equipment and just the retention rate would be important. And then the limitations for this was last year. We didn't have to have connected devices. There's a lot more software and connections and requirements for now. It needs to be a connected device. And then it's a little more vague with the 2021 reimbursement CMS codes about this 2 days of monitoring, if it's directly related to COVID or if it extends to other diseases during the public health emergency. But we typically we're looking for 16 days. And then a little bit about our program. The other important part, I modified this from a paper that we published in Emergency Medicine Journals. We found that removing people from our acute remote patient monitoring is very important. So while you're monitoring them, graduating them when they no longer need to be monitored is important because it's a lot of information to manage. But I'm happy to take any questions if anyone has any.
I have a quick question, if that's all right. Sorry, I'm terrible at typing, so just thought I'd ask it in person. Kind of knowing what you know now, so kind of applying this to COVID, kind of going forward, do you think it'll be cost effective in other diseases and other types of patients in the emergency department that you've identified?
That's a good question. moving forward, you have to have connected devices, so they're slightly more expensive. So that will eat into any sort of margin you would get. I think if the second part that would be difficult, especially from the emergency department, is understanding your patient's engagement. I think the most important part of an ED based program like this, again, would be you would really need to spend a little time understanding your patient and how engaged it would be. I would want to look for someone who would participate for 16 days, probably at this point, thinking outside the public health emergency. I think it would more likely probably be in concert with a primary care doctor. For example, in our institution, we have internal medicine and family medicine. I would probably work in discharging, say, a patient who had hypertension that was uncontrolled, give them a pulse ox, and I give them a blood pressure cuff, and I would move forward. As far as COVID's concerned, it's a little more complicated, and I think there's some talks later in the conference that this can even get to not an RPM with the reimbursements, but sort of a hospital at home situation where you're extending your hospital, with much more resources involved. So I think it is possible, but just the cost involved, I would be much more careful moving forward.
And I failed to mention earlier, anyone can open up their mic if they'd like to ask any questions. No, it doesn't have to be in the chat box. Okay, well, thank you, Dr. Hood. We did get one more question about the smart glasses. What kind of software is used to connect the glasses to Zoom?
Right now we're using the software MD Air Support, which really simplifies the glasses use and the glasses use with Zoom. So MD Air Support, you just pull up the app and then Zoom automatically it starts running. There's actually a Zoom meeting that indefinitely runs forever. So it's already ready to go once you pull up the MD Air Support app.
Anybody have any questions for any of our presenters? Well, since we were short one poster today, I'm going to give you back your all's time this afternoon. You're more than welcome to go over to the virtual exhibit hall or the Zoom chat with our lunch and keynote speaker. Also, do not forget, go online, vote for all the posters that you participate with and during our conference. And thank you all very much for attending today.